When should you bring that person to their healthcare provider to be evaluated? And it really is different for children than for adults. For adults, if they've had a prolonged fever for 4 to 5 days and they don't seem to be getting better, they should definitely see their healthcare provider. Also, if they have any comorbidities such as diabetes or lung or heart disease, they're potentially at more risk for complications from swine influenza or any other type of influenza, and they should see their healthcare provider. Anyone who's having difficulty breathing or is short of breath or feels faint or is not acting like their normal self, they're either confused or acting inappropriate, those would be other indications for seeing a healthcare provider. Lastly, if they've had vomiting or diarrhea and they don't seem to be able to take enough fluids in to maintain hydration, and they seem to be getting dehydrated, their mouth or lips are quite dry and they feel lightheaded or dizzy when they're standing up, that would be another indication to bring them in. In children, everything I just said for adults holds true. But sometimes children can't tell you that they're short of breath, especially infants are very young. And so what we look for is rapid or labored breathing. And sometimes this is manifest in a small child or an infant in them sucking or pulling in their chest or their abdomen when they breathe. We call this retractions. And when you take their shirt off, you'll see they're pulling in their skin by their stomach or their chest. They also have nasal flaring, so you'll see flaring of the nose. This is another indication that the child is having difficulty with their breathing and a clear indication that they should see their healthcare provider. If you see any bluish discoloration around the lips or the face, something we call cyanosis, may indicate they're not getting enough oxygen and they should see a healthcare provider.